All right. Well, good afternoon, or whenever you're watching it. We're broadcasting live right now, and it's good afternoon. So good afternoon, everyone. And it's also the holiday season here, so happy holidays. Welcome to the Empowered Living Club and this session of Perspectives on Aging in Place, a series of discussions that we're having with experts on that particular topic and how to stay home longer and things like that. So today's topic is the Parish Nurse Program and how it can work for you, particularly for you if you want to age in place and you want to try to stay home as long as possible. So as I just said, welcome to the series. It's aging in place, how to stay home longer. And as I say today, it's on the Parish Nurse Program. This is general education for the public. This is not specific advice, certainly not advice that anyone can rely upon or is entitled to rely upon. And we think everybody probably knows that, but we put in a disclaimer slide anyway. And as I also indicated, it's the Empowered Living Club, and it's run by GolderCare. It is, and I'm not going to go into the history of it today, it is the updated equivalent of what used to be called the Aging Solo Club. The mission of that has been expanded, the membership has been expanded, and it's now called the Empowered Living Club. So our little motto there is mastering the challenges of aging together. Today's participants, the experts, I guess you would say, are myself and Linda Giebert. And we want to welcome you, Linda, and thank you for joining us today. We've known and worked with Linda for many, many years, and with the Parish Nurse Program. So she has been doing this for quite a number of years, a lot of experience, and she's been with parish nurses for quite some time, and run the program here locally, or one of the programs here locally, and educated on it. So we've got an expert. As I say, today's topic is, what is the Parish Nurse Program? So we're going to get started with that. Linda, as I say, welcome. We're glad you're here, and we're interested in discussing this topic with you and hearing your experiences and your insight, and we're hoping that this is going to be a wonderful experience for all of us. So thank you. We have a series of 6 slides, as any of you know who have viewed these before. These are not presentations. These are discussions. These are intended to be insightful as opposed to teaching. And there are a series of 6 slides right here that just go into some things that the parish nurses do. So I guess I'd start out and say, Linda, you want to give us a little explanation in general of what the Parish Nurse Program is, and then we can start talking about some of these areas that of help and expertise.
Sure. Thank you, Jamie. It's a pleasure to be here and to talk about parish nursing. You also hear it called by faith community nurses. And they're nurses that work within a church of faith community. And our role is to promote wellness and holistic health in body, mind, and spirit. So health promotion is one of the things we do within a faith community setting.
So it's for everybody who may be within the church. It's not just for the elderly or the disabled or the ill. It's Correct. Really pretty much for everyone within that congregation or group or whatever. Is that right?
That's right. We care for people from the cradle, we say, to the grave. So all ages.
Is it, and it's primarily connected with or tied to a particular congregation? Is that how it works?
Well, the nurses work within a congregation setting. So yes. Okay. Right. I have a couple nurses that have 2 churches, but mainly it's one nurse or a health advocate within each church.
Okay, so that led me to another. You just led me to another question. Are they all nurses, or are they sometimes other health advocates?
Yes, good question, Jamie. We are registered nurses. However, we have opened our team up to what we call health advocate or health minister that would work alongside a parish nurse or under a pastor's guidance. And those would be individuals that have a passion to promote health and wellness within the church. And I have individuals that have worked in the hospital as a physical therapist, pharmacist, an occupational therapist, social worker that want to contribute using their expertise and their skills within their churches.
I would think that would be an excellent addition, source
Yes.
of people to do this. And as a person who identifies myself as the passionate patient advocate, I can certainly empathize with what you're talking about.
Right.
I think that's great. So this slide talks about one of the areas of activities of parish nurses, and it says health promotion. What can you tell us about that?
Okay, some of the things that we would do to promote health within the church setting are, as you see here, taking blood pressures, doing blood pressure screenings. As you know, somebody could have an abnormally high blood pressure and not have any symptoms. So it's important to be screened, and that could give us information that we can help the individual look at ways of decreasing high blood pressure, getting them in to see their healthcare provider, discussing medications and dietary practices that can help lower blood pressure to keep people out of risk of having stroke or adverse health effects from high blood pressure.
Sure. Okay.
Other
I guess I
things we
need to
do,
stop by the parish nurse's office a little
yes,
more.
yes, we should all be monitoring our blood pressure and actually knowing our numbers. And our blood
Yeah.
pressure is just one of those. Other things we need to know is what our blood sugar is, our lab work, our cholesterol and fat level in our blood, and also our BMI.
I was
And
just going to
that's
say.
our weight, and that all contributes to our health and long-term survival and prevention of chronic health diseases as we age.
So that's certainly something that is likely to keep us at home longer and aging in place to the extent that we can prolong our health.
Absolutely.
Okay. Other aspects of health, whatever it is, health uh, promotion that we need to touch upon. Any?
Um, well, I didn't mention one thing was exercise, and something that the parish nurses do. They would offer exercise classes, sometimes Tai Chi classes, yoga classes, and that is also helping us to stay well as we age and keeping strong muscles, strong bones, helping prevent falls. We offer classes to increase our balance, prevent falls, and that's so important as we age. As you know,
Okay.
the risk of falls and fractures increases as we age, but if we can keep our muscles strong, our bones strong, and keeping active, that contributes to our longevity.
Yes, I think I don't think we can overemphasize the importance of fall prevention because that is really one of the catalysts that sends so many people over the edge, either into long-term care or actually into the next life.
That's right. That's
Yeah, for sure. So we have another slide that we have here, and it says referral and advocacy. So this is another area of the parish nurse duties and activities. Is that correct?
That's right. And what this refers to is sometimes we'll have people coming new into our community in the churches, and they don't know who to go to for healthcare providers. And so we have a list of physicians within our system that are accepting new patients. We can also use resources within our community that my team is very familiar with, such as home care agencies that might provide services in the home, somebody who might need help with finances, with food, all sorts of things that we know where the resources are within our community and can make those referrals and advocate for our individuals to get those services surrounding them.
Okay, yeah, you bet. That's in some respects, that's kind of um, a social work function taken kind of to the next level, kind of expanded
Right.
right into the congregational setting.
Absolutely.
Yeah, I think that again, the importance of that really cannot be overstated. It's a very important function, even for people who have lived in the community for many years. If you're not if you're not familiar with all of the healthcare system and all of that, it's so easy to be put off by it.
That's so true. And an example of that is transportation. Some of our seniors that don't drive anymore, they live alone, sometimes have difficulty finding transportation to doctor's appointments or to Iowa City. Our parish nurses can do some of that and help, but we also know the resources available for transportation. And I could work closely with our case management department to make sure those are updated as we get new resources and get that information out to my team so they can utilize that to help individuals.
So that I would emphasize too that transportation is one of the big expenses and obstacles in terms of retirement and aging. It's coming after health and housing. It's probably bigger even than than healthcare expenses. Do you sometimes organize transportation within the particular congregation as well as other public resources, or how do you go about doing that?
Yes, some of the nurses would have that ability to help with that or know people within the congregation that would be willing. An example is the American Cancer Society has transportation help that can help individuals get to their chemotherapy and their doctor appointments. Another thing that just recently started within our community is Metro is providing free transportation services on the Illinois side to our veterans, which is
Yeah.
wonderful. And in the Iowa Quad Cities, they're already providing free transportation to our veterans. So that's wonderful that we have that right here in our community. And individuals don't know that. They do have to complete some paperwork to get that done, but great service.
It used to be that you had to essentially qualify for like a Medicaid piece, but I'm not certain that that's the case anymore. I don't know one way or the other. What's your understanding on that?
Some insurances and Medicaid on the back of the card, there's a number to call for
Ah,
transportation services. So some of
okay.
them do have that as a benefit.
All right. I was just gonna when you mentioned that, I was going to ask you about the American Cancer Society because they are quite active in
Yes.
the cancer transportation piece
Mhm.
for cancer treatment. And you mentioned Iowa City, and for people who are not familiar with the Quad Cities, that's a regional hospital and educational center about 50 miles away. So it's not something that a person can meet or just make that trip every day, especially if they don't drive or they don't have an automobile or other transportation. So
Right.
I think that's of huge importance as well. And
Yes.
I think that's fantastic. What's our next slide, Gail? Visitation. Tell us about that. That's something that you
Yes.
don't normally think of when you think of health services and health professions.
This
Um,
is such
this
an
is
important,
Yeah,
I'm,
I was going to say this has got a different flavor. So I'm eager to hear what you have to say about that.
well, the nurses will go and visit their parishioners in their home, especially those that are homebound, living alone. Oftentimes, the children are on the east or west coast, not in the area. So it's important to have somebody that could go in and do a good assessment and make sure the resources are there. We also visit our parishioners in the hospital. So we can see what healthcare and discharge planning and education will be needed. And when we go into the home post-discharge to make sure that they have their medications and perhaps assisted devices like walkers or canes to prevent falls and to encourage healing within the home. But we'll also visit into long-term care settings, so nursing homes, skilled nursing assisted living memory care unit. So we really have that continuum of care and know our people well because we've been in their homes, we've visited them wherever they're at, besides
Well,
like within the church.
and as I see it, that is really an important bridge between medical care and spiritual or church care. Um, you've got a foot in both sides,
Correct.
and that's a gap that would otherwise probably be not filled.
Right. Right. Because not everybody qualifies for home care, or you
Right.
may have to pay out of pocket, which is quite costly. And the nurse can do a great assessment, communicate with the healthcare team if there's any issues that are seen while visiting in these settings.
Yeah, that I think that is probably one of the signature pieces of the Parish Nurse Program that sets it
Mhm.
apart and above and beyond what you might get with a lot of other resources.
Yes.
Facilitate ministries, so that really kind of gets into the spiritual end a little bit more. Tell us more about that.
Well, within the church setting, and we have all sizes of churches from, under 100 to over 1,000. And so you can't do it all yourself. So we have people within our churches that have expert skills. So, for example, some people may be yoga instructors or teach Tai Chi, and they can conduct courses there in the church for their members. We have individuals that are nutritionists or dietitians that can help teach healthy nutrition and cooking skills. Social workers, pharmacists that can help in a variety of ways and come alongside and work together as a team. So you really can assess the needs in your congregation and what type of activities would best benefit and promote health and wellness.
Right. And it kind of keeps you on your toes too, because you're constantly connecting and going through a lot of different situations with a number of different people. So I think that experience that you get as you work that program um, really starts to kind of spread far and wide the more experience the, the parish nurses have.
Mhm. And just engaging
Yeah,
volunteers to help and everybody to do their part to work together.
yeah, yeah. Um, I think we have another slide or two on this. Okay, let's talk about that. We were talking about kind of that bridge. So can you tell us a little bit more about this?
Sure, our team, our parish nurses, can spend time with an individual and to assess their needs of body, mind, and spirit. So that is we can take time to sit and pray with somebody, to listen. Today, everybody is so busy, nobody has time to listen to the stories. There's such rich stories that people have, for example, for our veterans and those that have fought in wars and what they have to share, and generations that have stories of the past that they just want somebody to listen to them. And our parish nurses can do that because they don't have to rush on to the next um, home to care for that person, but they could spend time and get to know them and to find out what it is that's either a problem for this person or what brings joy to their lives. We might take prayer shawls out to somebody who's in a health crisis or who's been just experienced a loss of a loved one, and spend the time in that healing relationship when there's deep grief and crisis. So there is just that spiritual component that today you wouldn't get anyplace else. In the hospital, we are so busy caring for physical needs that oftentimes the psychological and spiritual needs can't be addressed within a few days of a hospital stay. So that is the specialty of parish nurses, is intentional care of the spirit.
Yeah, that I've seen it firsthand. Just the impact that giving someone a prayer shawl can have, and and heard them describe, how much that meant to them.
I just had that very story yesterday. One of my retired nurses passed away. When she was in the hospital, I gave her a prayer shawl. It was very soft and warm. And her daughter shared that she wore that all the time when she went into long-term care. She had it with her, and it was so soft and comfortable that she was wearing that prayer shawl when she died. And they said, Linda, that brought so much comfort. We're going to make sure mom's buried with that prayer shawl.
Oh,
So
wow.
it's very touching to me to hear that.
It
Seems
is.
like a small thing to do, but so meaningful.
But it's meaningful and it's powerful.
Yes.
I think so. So, yeah, that again is as you pointed out, is a unique aspect in terms of what the parish nursing program can do that the rest of the healthcare system is not well equipped to do, or even sometimes equipped at all, or allowed to do.
I'm very pleased that
Go
our
ahead.
nurse, I'm sorry, Jamie, that practice has carried on here in our hospital, and in our chaplain office, our volunteers make crochet or knit prayer shawls, and our nurses have now the opportunity to come to the chaplain's office or our chapel to get a prayer shawl if they have a patient that could critically use one in our ICU, or someone who's needing that comfort at the end of their life.
So the spirituality in the Parish Nurse Program is spilling over into the mainstream healthcare system, particularly in hospitals and clinics.
Yes, at least here, because of the work that we've done, and nurses have seen the benefit when we've come up to the hospital. They want to be able to provide that to other patients.
Yeah, I think so. That's fantastic. That's wonderful. And then, of course, this one says communication and documentation. And of course, we wouldn't have nursing situations if we didn't have documentation issues. So I think communication is even more important, but the documentation is certainly required, isn't it?
Yes. Well, we communicate with the healthcare team, and we can, after assessing one of our parishioners and there's a need, we can get on the phone and talk with the doctor and communicate with the healthcare team. But today we even have the digital communication. So people have their chart, my chart, or your healthcare portal. And I'll give you an example of one of my nurses in the past. She had an elderly gentleman who was being seen by many specialists because of his health condition. So he went to University of Iowa, and he saw many doctors there. They would document in his chart, and she would bring him back to the Quad Cities. And then he wasn't able to get on his portal, but he gave her permission to go in and communicate what the doctors and healthcare team in Iowa City did with the doctors here to make sure that there was a continuity of care. And she was able to do that because she had the computer skills, and this elderly gentleman was not able to. But both teams appreciated that and benefited from that nurse being able to communicate through the healthcare portal.
Oh, yeah. Well, we talk so much about the need for care coordination, and it seems to me that's exactly what you're describing there. Is a form of care coordination, which we so often don't have.
Right.
Yeah. Yeah, I think that is an aspect. I guess the point I'm thinking about right here is the parish nurse as a health advocate. In the parish nurse program has a certain ability to go above and beyond what private patient advocates can do. So at GolderCare, we do private patient advocacy, but we're not connected in that information technology system as you are. We can't do the direct communication with the doctors. If we do it, it's through more traditional channels. And sometimes these days it's a lot more accepted than it used to be. But at first, we appeared as a patient advocate, people would wonder, well, what's this all about? And what's your place, et cetera, et cetera. Whereas with the Parish Nurse Program, when you folks are involved, your your role has already been uh, established and
Right.
fairly well defined, and you've got the communication channels open. So even if we're using a private patient advocates to do care management or long-term care management or something like that, I think even in those situations, the Parish Nurse Program, as I see it, is likely to be helpful and just an additional benefit that adds to the power and value of private patient advocacy. What do you think about that,
Well, I was
Linda?
going to add one other thing we're able to do is we have attended doctor appointments with our individuals, our parishioners, and that's to help interpret help health literacy. So help our individuals understand what the doctor's communicating. Sometimes we could use medical lingo and them being that bridge of communication. So when they go home, we can review. Now you understood this is what the doctor wanted, or make sure we get them to the pharmacy and make sure they're taking the right medication. And so that communication part is very important. And that the doctors do respect that a nurse is sitting there that is going to continue to see this person after they leave his or her office.
Yeah, I would say in some respects, they probably are relying on that, and
Mhm.
uh, uh, that relieves them of the responsibility from being very uh, uh, strong in their advocacy because they know there's already an advocate on board.
Right.
Yeah, that's my um, that would be my perspective on it. So this slide says the Trinity Parish Nurse Program, and this is the particular Parish Nurse Program that you are involved with and have been for some time.
Mhm.
How long have you been there? And tell us about this program.
I started in my position in 2008, but our program started out of Lutheran Hospital.
Oh my.
Um, Harriet Olson, the director of nursing at Lutheran, got a visionary group of people and communicated with Granger Westberg, who started the Parish Nurse Program in Chicago in Advocate Health. And he started off putting health clinics in churches and saw the importance of a doctor, a pastor, and a nurse. Well, churches aren't set up to provide confidential health care. So then he saw putting a nurse in a church and being able to communicate with the pastor and the doctor. So we started in 1989 here in the Quad Cities with about 7 churches and 7 nurses. And from there, it's grown.
Oh wow. Yes. Well, um, Gail, my wife, and my mother-in-law, Mary Glockoff, were very familiar with and friends with Harriet Olson. So I'm glad to hear
Mhm.
you invoke her name. Yeah, that's an interesting point that you bring up. Um, Obviously, I assume that most of what is discussed between the patient advocate, the parish nurse, and the patient is confidential, obviously, except to the extent that the patient or the parishioner waives that. Are there any special provisions there? I mean, I assume that it's that it's fairly de rigueur that the parishioner is going to allow the parish nurse to discuss things with the pastor if appropriate.
Right,
Um,
only with permission. And we don't even put prayer requests out there unless we have permission from individuals to put somebody on a prayer chain that some churches have or to communicate. It is very confidential.
okay, yeah, I get that. Um, and you know there are some interesting pieces here uh, that kind of come to mind. For instance, when I have employed nurses at GolderCare in doing private patient advocacy, um, generally speaking, and we don't, private patient advocates don't have to be licensed, but if you're going for errors and omissions insurance, malpractice insurance, generally speaking, nurses who work in an office such as ours are not allowed to do blood pressure because it starts getting too heavily into the medical side. So I would suggest that's another nice thing about that, about the Parish Nurse Program.
Yes, yes. That's just one of the screenings. We also do foot care clinics. And so individuals can come into the church and many of the churches open that up to the community, where we will have foot care technicians from our Unity Point at Home office come and soak individuals' feet and cut their nails and file them and inspect, which is sometimes difficult for people as we age to see the
Yes.
bottom of our feet and make sure there's no ulcers that could create infection, especially if you have health disorder like diabetes that could lead to serious complications.
Yeah. Yes. That's obviously very important as well. In terms of transportation, are you allowed, not that you normally would, I would expect, be expected to transport the parishioner or the patient. Are you allowed to do that, or is that frowned upon?
That's a good question, and that is up to each church and the rules set by their denomination or their pastor. Some churches do not allow that because of liability, but it is expected that nurses do have liability insurance if they're going to be transporting individuals.
Okay, I get that. Yeah, I think that's a very important point, that kind of in the infrastructure of things that we don't see or talk about necessarily every day. So how many in the Quad City area where we're located, how many parish nurse programs are active, would you say?
So we are the only active program. There was a program that started at Genesis from a nurse that took our course back in 2000, and they had a program there, and Genesis eliminated that program. So I invited any nurses that had been part of the Genesis system to come and join our team. As parish nurses, we don't feel competitive in that way. We think there should be a nurse in every church, regardless of where they're aligned or what hospital system they're a part of. So we've joined together in the Quad Cities and have one program here.
And about how many parish nurses are there?
Right now, we have about 30 parish nurses and health advocates.
Okay, so it's helpful to locate a congregation that has a parish nurse, and it's part of the Parish Nurse Program, because I think it really adds a level of service to both the medical care and spiritual care that churches without aren't in a position to do.
Right.
Yeah. So do you have any, oh, what do we have here? We have another slide. It says goals of aging in place. So this is a question that says, as we said earlier, parish nursing isn't just about aging in place or people who are sick. You're trying to keep people well, et cetera, but any particular insights that you have in terms of how the Parish Nurse Program is really able to help people age in place and stay home longer?
Well, I think just the fact that we're able to visit individuals within their home to assess the need. Is their environment safe? Do they have all of the equipment to make their home as easy to get around as possible? Do they have the food, the resources, as I said, the transportation? I have nurses that will contact their parishioners during the week just to be sure they're okay, because if somebody would fall and they have no family or anybody checking on them, they could, potentially lay for days before somebody might find out that they're not up and about. And just making sure they're getting to their doctor visits, that they're getting all the services, if they need home care, if they need nursing assistants to help in the home, if they just need friends to contact them or bring in meals. During COVID, it was a very difficult time, and many of the parish nurses got things to homes of those that lived alone, homebound, didn't get out. food and just connection, a smiling face, cards. They would do birthday parties out in the yard of 90-year-olds that could
Sure.
not be in touch with their families, or making sure they were getting their groceries, and communication about what was going on, and how to get scheduled for vaccination or whatever the case may be. But just so important, and how to stay healthy and stay well to prevent long-term chronic illnesses as long as possible.
Yeah. I'm thinking that that the nursing that the parish nurses are really almost a complementary type of service that adds to so much to what everyone else is doing. And I think that's been kind of a common theme in some of our discussion. In some of the things that you were just discussing there, how much some churches have, say, the church we attend has what's called deacons, and the deacons really serve to help spiritually and socially keep members of the congregation in touch. How much do you extend, say, what the deacons do, or the deacons extend what you do as parish nurses? How well do those things work together?
Well, I think working collaboratively to see individuals at home. And if you do have a big church, there's a lot of individuals that maybe aren't not being seen if they just don't have that deacon, those deacons willing to go out and make home visits and make calls, and the importance of the social connection. And I think having a nurse there, when we work with other lay ministries, if the deacon or lay minister has a question, this person gave me some information that maybe a nurse should see them, or they're not feeling well, or they're not sure about this or that a nurse can go and do that assessment, either call them on the phone or go out and check their blood pressure and see what their symptoms are, and then make sure they get connected or get in to see a healthcare provider to prevent problems.
Or stave off problems that haven't been recognized yet?
Yes.
Yeah.
Absolutely.
How often do you get much resistance from some of your potential what you would say clients, patients, whatever?
Well,
What do you do with that, and how much do you get?
I think that there are individuals that are very private and they don't want to
Mhm.
allow anybody in their home. And we certainly understand that. People have a right to say no to a visit, but we will continue to stay in touch by phone, or, send cards letting them know if they need anything, we would be there. But we certainly don't force services on anybody.
Sure. So sometimes it's simply a matter of they're not ready.
Right. Mhm.
Yeah, we see that every day in our dealings at GolderCare, and so I think that's one big similarity between
Yeah.
what you're doing and what we're doing. It's not uncommon for people to say, "I'm not ready yet," and part of it is just getting them to that place.
Right.
And your card program, your reminder program, etc., is one way of doing that that I think is quite beneficial, and I think it's oftentimes quite effective too. People
Mhm.
have to stop and think whether they're ready to kind of move to the next step, and or to admit that they need some or could use.
Mhm.
Maybe they don't need it, but they could use
Right.
a certain amount or certain level of help.
Sure. And it might even be offering to bring a meal out. Somebody who lives alone, oftentimes, it's more fun to eat with somebody than eating alone every day. So offering to bring a meal or a loaf of bread, or, a tray of cookies, whatever the case may be, and just offer that and get to know the person. And once they get to know you, they may be more open to visits.
Yeah, I think that's truer words were never spoken. What happens if somebody's not particularly affiliated with a congregation, but they're thinking, maybe I am interested in that, and maybe I'd like to see what's available. How do you handle that? What do you say to those people or family members?
Yeah, I get those calls sometimes and ask individuals if they are connected to a church. We'd love to be able to offer our services to everybody in our community, but unfortunately, that's not possible. Some churches do have neighborhood outreaches and invite people in. An example would be to food pantries. It's not just for church
Sure.
members, but sometimes meals are served in the church and they say, come, we want our community to come. So that is the place where you would get contact. And if anybody wanted to go into a church and have a meeting or call to meet with a parish nurse and see what kind of services can be provided, they're open for that, but they just can't, offer everything to everybody in our community, unfortunately.
Well, and I assume does most of the money to support parish nursing come from the individual congregations? Do you get
Absolutely.
grant monies from elsewhere? How does it work? How's the
It,
financing work?
it is the congregation because that's where the services come from.
Mhm.
Now, we
Okay.
do have since you said that, we do have a nurse that is at Christian Care, which is a homeless shelter in our community in Rock Island. And we have a parish nurse there provided by a grant 1 day a week. And she is able to do assessments, to do blood pressures, to find physicians if there's a healthcare need. She gives education, hands out hygiene products. During COVID, she was giving people masks and hand sanitizer and just there if somebody needs to come in and talk and say, this is my problem, I have sores on my feet, and she can help address those type of things.
Are most of the parish nurses women? Do you have any males, either locally or elsewhere that you're aware of?
We do have men, and I've had a couple men in our program. um, Unfortunately, one has retired and another one moved away. And one of my elderly health ministers, there was a wonderful man who had been a veteran in Vietnam, and he just wanted to serve his community. And he was a great part of our team. He passed away several years ago. But yes, we're open to men as well.
And how well does that work out? I would imagine that that a lot of men aren't too resistant to having, say, a woman as a nurse help them. Is that the same way with some of the women? Are they a little more reticent, or are they pretty much just as open to that?
Yeah, Jamie, I've never gotten any comments about that
That's
because
good.
these men have been in the church and the women know them from their church and know,
Yeah,
how caring they are.
sure. And well, and of course, if you're talking to a pastor, so many of them, at least over the years, have been men. A lot more women in the ministry these days than there used to be.
Right.
So, okay, that's an interesting part too. So, and I had shared earlier. You had shared with me earlier a little story about, I think it was during the pandemic, about just one example of what parish nursing was able to do.
Yeah, this was kind of a unique story. One of my nurses told me she had a parishioner who was disabled, had been in the hospital a long time. And she discovered that the bathroom in the home where he was going to return to would not be appropriate for his use. So she brought that to her church leaders and the council, and they found a way to raise money and get individuals out there to remodel that bathroom so it would support his wheelchair and him, and then he was able to be discharged home. So it was because of her assessment of the situation and then her willingness to say, hey, we can find a solution to this to help this family. And so that's just something you might not think of a nurse doing, but that's just an example of coordination of care and
It
doing an
is.
assessment of needs to find out.
So there's an assessment followed by a coordination of care and advocacy. Active advocacy is what I'm hearing
Yes.
from that situation. And
Mhm.
all of that came together and was really corralled or triggered by the parish nurse in this
Right,
particular situation. So
right.
I think that, to me, speaks as an example of just how powerful this program can be.
Can I share another quick
Yeah,
story
please
that's very
do.
impactful? So during COVID, one of my nurses visited an elderly couple. They were in their mid-90s. And of course, they couldn't go out. And it was just happened to be during derecho. So they had no electricity. And she went to assess to see how they were doing and take them some food and discovered they had no food and they had no lights. And she was concerned that they could trip or fall. So she went out to her car and brought in a flashlight and reviewed how to use it safely to get around the house. And then she went home and cooked them a meal and brought that back and just continued to follow up on them because they had no family and they were just isolated in their home during derecho and the COVID. And so she was really a blessing to this couple.
That's for sure. And you bring up a point there. As I mentioned earlier, the Empowered Living Club started out from the Aging Solo Academy that we purchased from Iona Senior Services in Washington, D.C., and it turned into the Aging Solo Club, and now the Empowered Living Club. As I say, we expanded the mission and the membership. How many of your people that you work with are a large percentage of them don't have family, say, in the community? Is that a major part of your ministry?
That's a lot of it. Not, I wouldn't know say if it's major, but as young people move away and you have folks that are still here and not a lot of children in the area, or just one or two or none. That is something that they really do focus their care on because that's the highest need and the most vulnerable. But we also have children, and they have church programs that have tutoring programs or feeding programs. So in some areas of the community, also ministry to help children get nurtured, get the clothing or the food that they need in some of the, at-risk population areas.
So back to that original piece, and that the aging piece is just one part of the parish nursing program.
Right.
Yeah, I think so. So here's a slide that says what else we haven't discussed comes to your mind, the top of your mind, in terms of what we ought to know or what people ought to know about the parish nursing program.
I guess one thing, if you know of anyone, a nurse who's retired or who would like to use her skills to help within a church community, to contact me. I do a class once a year, and we're always looking for more people to serve in our churches and in the community if there's need. So contact me if there's any questions, or if you know of anybody, I'd love to talk with them about coming on to our team.
So wherever you are or wherever mom is, support your local parish nursing program. And if you're the material to do it, please consider doing it. Is that what I'm hearing?
Sure, that's good, Jamie.
How much extra training do people have to get in order to do this?
Right, so our nurses go through a 36-hour course, and I teach it right here at Unity Point Trinity, usually in the fall. So we meet for 6 weeks and cover all sorts of topics and share resources and have speakers come in to help them prepare for the role that they'll be doing. But I do tell them every church is different and the needs are different. So when you go back, you have your pastor and you have a wellness team to work with to say, how can I best help in this setting?
Yeah. So do we have, what's the next slide, Gail? Could you show us that? That's what I thought. So are there any questions that come in that we need to answer at this time?
So the method for questions, there is a chat area on Zoom, and you can type your questions into that chat box, and then I'll read them to our presenters. If you think of a question after we're done, you can always email it in to the office, and the email address is at the bottom of the slide, and we will get back to you on that. One question I do have for you, Linda. I know the parish nurse at our church has done Heart Healthy in February. We have snacks after church. It's usually the donut, really healthy donut stuff. and coffee. But when in February for Heart Healthy, we always have one Sunday that we designate for her, and we'll have fruits, little baby bagels, juice. We'll have a variety, usually, maybe 6 different things, but a variety of healthy snacks that you could have instead of the donuts. Is that common among
Yes.
other parish nurses, or is that just our Laura?
Gail, that's great. Some of the nurses do that. In fact, I had a nurse that had been a home economic teacher in the past, and she would set out things. You could have a donut for 400 calories, or you can have this cheese and crackers and fruit for only, 100 calories. And she would prepare healthy little treats instead of the donut. And so we always want to encourage people to have healthy options, because there are some people that are trying to struggle to say no to some of those things for their health. And so if you have something a little more healthy, that's a great way to educate people and to promote their wellness.
While we're waiting for anybody to ask any questions that come to mind, I would say this has been a good discussion, I think, certainly for me. I have learned from it. I've gotten some insights, and I would share with all of you the insights that I get from this are largely that this is a really important and powerful program. As Linda indicated, I wish it were available to everyone, even people who are not necessarily spiritual or religious. I think could certainly benefit from it. But I think I wish it were available to everyone. And as I see it, it is part of the, it complements other aspects of healthcare and spiritual care. It's part of the coordination and communication and education process. It's part of advocacy. And interestingly, I really hadn't given much thought before the discussion now in terms of how parish nurse advocacy and program and private patient advocacy, such as we practice it at a place like GolderCare, how those compare, how they differ, how they can complement each other. There are things that one can do that the other can't. And so it seems to me that layering on some of these services is, generally speaking, only a good thing. And again, I think I wish that this were available to everyone, particularly everyone who's trying to age in place. Your thoughts, Linda?
Well, I'm so thankful that Unity Point Trinity has continued to support this program by supporting my role, paying my salary in order to coordinate and be the leader for this program. And so I'm very happy that they see the value and how we can help people. And that's the mission, to improve the health of individuals in the communities we serve. And that's what we're doing. That's one of the missions of our hospital. And I'm so thankful that we're here and able to do this work.
Likewise. And
I have one other example of our parish nurse. A couple of us noticed one of our members who's not likely to, she doesn't have family locally, and we noticed, we thought, failing memory and some issues. And so we approached the parish nurse and said, could you use your magic to gently talk to her and see what you think? And so she, being somebody that talks to each other all the time, she could easily step in to this, church member and talk with her and kind of give an assessment and direct her to possibly, something in addition that she needed. But it's an easy step. What we hear a lot of times from families is, oh, Mom won't go to a doctor. Mom doesn't think there's anything wrong with her memory. Dad thinks everything's perfect. And if you have this person that they see frequently and trust before, it's not as scary as going to a doctor.
That's right.
So
And
I
that's a
see the
good point.
parish nurse as kind of an in-between.
Yes, Gail, that's a good point. We deal with that quite a bit. And again, on the phone, a child might think, well, mom and dad sound okay. But when the nurse goes in and finds no food in the refrigerator, or, things aren't quite like they should be, that's a different story, and can, talk with the children and say, it might be time to come home and do a visit and assess things. And
And we'll get you the resources you really need.
yes.
Okay, but before we get to this particular slide, if people are looking for Parish Nurse Program outside of the Quad Cities, is there a central a place that they could look to see if there's a Parish Nurse Program in their community or
Yes,
anything like that?
you can do a search engine on parish nursing, faith community nursing, and actually the Spiritual Care Association now is the association we're under in the Westberg Institute, and that they could search that to find out other programs around the country, and look for resources there.
And I believe you indicated to me that it's not just limited to the United States.
Right. There's many countries, about 20,000 around the world. And it's very interesting to see how parish nurses are working in Africa, and other countries, and the work that they do to promote wellness in different situations than what we have here in the United States.
Yeah, that's just wonderful to hear and to learn about.
Mhm.
Any questions coming in at all, Gail, or not?
No, I am not seeing any.
So Linda, we must have either really answered all the questions or put people to sleep or something, but I think we've had a good, I think this has been a very good discussion as far as I'm concerned.
I think so too, Jamie. Thank you.
Thank you. This slide simply says there are some upcoming perspective on aging programs. We will continue to do this as one of the parts of the Empowered Living Club. Normally they're done on the third Wednesday of the month, but Linda and I decided we wanted to move this one up in December to the second Wednesday because we didn't want to get too close to Christmas. And I think that was a good idea. So you can see there are several things there, and we will continue to send out notices. What else do we have? And there's our concluding slide. So thank you for joining us today, each of you. And Linda, thank you very much. This has been quite beneficial and eye-opening even to me. And I think I have a pretty good knowledge of the parish nursing program over the years. But it really brings home the message that I think this is another layer or component or complement of care that everybody ought to be looking into if it's available to them. So we heartily recommend it. Thank you, Linda.
Thank you, Jamie. It's my pleasure to be here with you today, and happy to answer any questions in the future.
All righty. Well, thank you, everybody. And we will hopefully see you next time. In the meantime, this will be available on demand. Thank you. Bye-bye now.
Goodbye.